So, good morning, good afternoon, and good evening to everyone joining us from around the world. I am Rola Al Imam, Technical Officer on Water, Sanitation, and Hygiene at the World Health Organization Regional Office for the Eastern Mediterranean. It's a pleasure to welcome you all and to moderate part of today's global webinar on the WHO UNICEF Global Progress Report on Water, Sanitation, Hygiene, Healthcare Waste, and Electricity Services in Healthcare Facilities, Essential Services for Quality Care. This report comes at a pivotal time. Over 100 countries are now taking action to improve wash, waste, and electricity services in healthcare facilities, reflecting unprecedented political commitment to ensure that every patient and health worker has access to safe quality care. The report shows encouraging progress. Countries are establishing standards, conducting baseline assessments, and developing roadmaps. Yet, billions are still served by facilities without the basics, and progress will stall without stronger investment in infrastructure and systems. Notably, reporting has increased by 60% since the 2022 attempt, signaling a convergence of global will and an opportunity to embed these essential services within health systems. To walk you through and to walk us all through the key findings and insights from this new global report, it's my pleasure to introduce Dr. Maggie Montgomery from WHO and Ms. Lindsay Denny Naughton from UNICEF. Maggie and Lindsay, over to you.
Wonderful. Thank you, Rola, and really exciting to have you all here and to have so many of you that have worked closely and tirelessly on this issue together. Just real quick before we jump into the key findings, wanted just to review the objectives that, as Rola said, we will have the key findings. We're also super excited to have a number of countries and partners with us today and hear about their insights on how they're working to overcome some of these key barriers. And we obviously also want to make sure that we continue to constantly reaffirm our commitment to this work. And obviously, collectively, we know we can do more together. So you can see who's speaking today. And I will now ask Lindsay to pass to the next slide. So this report, which was just launched just a little less than 2 weeks ago at a high-level event hosted by Hungary and Philippines, who are the co-hosts of the Group of Friends of WASH and Healthcare Facilities in New York, is detailing what national actions countries are taking to address WASH and healthcare facilities. It includes data from 101 countries. So this is a significant increase in the number of countries that are now reporting their actions, which already in our analysis shows that there is increasing national commitment and action on a number of issues. There was a data validation process. I won't go into details, but you can read that in the methods. And where possible, we tried to make sure that we were able to gather the standards, the roadmaps, the monitoring indicators to really show that these actions and steps were taken. The report also includes all 3 years when we've collected data on these national actions. So that's from 2000, 2022, and 2025. Next slide. So I think it's important before we dig into some of the details just to remind ourselves, what is the new imperative for making sure that these basic services are there? Well, increasingly we see that it's essential that facilities and countries have safe, climate resilient, and environmental sustainable healthcare facilities. We're seeing increasingly the harms that is happening to health because of climate change, and this makes making sure we put in these practices even more important. Primary healthcare and quality care is increasingly the central focus on the agenda in health systems, and water and sanitation services are quite critical to that. I'm not going to read through the whole list, but also just wanted to highlight that some of the progress on reducing preventable maternal and newborn deaths has stalled. And this is happening in the same countries and the same places where we're seeing there's still a major lack of wash and waste and electricity services. Just some other areas are the new Global Action Plan and IPC very clearly calls out the need for better services and the monitoring of those services, as well as commitments around AMR. On this graph here on the right, you can see that there is a clear economic gain that can be realized by investing in such services. So the benefits far outweigh the costs. For hand hygiene, we see it's $24 gain for every dollar invested. And for environmental cleaning, which is often neglected, we see that there's a $5 gain for every dollar invested. Next slide. So this just gives a summary of where we are globally on the progress at the national level against the global targets. And these targets were set last year as part of a process to put together a roadmap from 2024 to 2030 to try to achieve or accelerate progress in achieving universal access to water, waste, sanitation, hygiene, and electricity. For some areas, if you look at the actions on the left around baseline service levels, around national standards, there's been quite a bit of progress, and some of the targets are quite close to being met. The targets you can see for 2028 and eventually 2030. But when you start going further down that list on the left, areas around national coordination, we're only at 58%. For regular monitoring within health systems, it's only at 21%. And the financing is where there's the biggest gaps at only 17% of sufficient financing to actually make sure there is universal access. Next slide. This is now giving a summary of the service levels, and this was data that our colleagues who run the joint monitoring program at WHO and UNICEF presented last year, and it's for all 5 key areas, and globally as well as in the least developed countries. Again, we're quite off track for many of the areas, in particular for hand hygiene and waste. In the least developed countries, the services are even further off track. There's still major data gaps as well, so that's another issue that needs to be addressed, in particular around electricity. Next slide. I also just wanted to highlight some of the inequities, because this is also a really important point, and it links also to the work on ensuring quality primary health care to everyone. In figure 7, again, this comes from the report and it's data drawing upon the JMP data set. We find that WASH services in hospitals compared to non-hospitals in the least developed countries, there's quite a big difference. And on the left hand for each of the areas, water, sanitation, hygiene, waste management, and cleaning, you see the percentage of hospitals that have coverage versus non-hospitals. So obviously, if we're going to try to make sure we provide everyone with those essential primary care services and catch people before they need to escalate to the hospitals, we've got to make sure those basic services are in place. Next slide. Okay, I'm going to hand it over now to my colleague Lindsay, who's going to go more into detail around the national actions and what we found.
Fantastic. Thank you, Maggie. So as we mentioned, we took in responses from 101 countries, the most we've ever had, looking at progress on these national actions. And looking across the board, 82% of countries have fully implemented at least one action. That includes the least developed countries. Fantastic to see on top of that, 17% of countries have substantially advanced and completed all of the national actions. Similar to the last progress report, the most implemented actions are baseline assessments and then the wash and waste standards. And you can see that in the green pillars here. The least implemented are the costed roadmaps, infrastructure improvements, and health workforce. In particular, the costed roadmaps, we're looking at costed roadmaps that have some sort of financing attached to it. So only 14% of countries had costed roadmaps in place that had some allocated financing. So we look at progress over the last 5 years, looking at data from 2020, 2022, and 2024, 2025. We see that similar to where we see we're having strengths this past year is where we see the greatest progress. So we see significant progress on the situation analyses and baseline assessments, as well as standards, particularly waste standards in healthcare facilities. There's been some progress on costed roadmaps and monitoring, not necessarily countries fully completing that step, but more and more countries are taking action to address these issues. We see the least amount of progress when it comes to national coordination and infrastructure improvement programs. And just to note, we have not monitored the Health Workforce Development Program in past years, so it was difficult to determine whether or not there had been sufficient progress over the past 5 years. And we did an initial analysis just to look at where were there opportunities for quick wins, and what does it look like when we look at the coverage of the data which Maggie showed earlier from the JMP as it relates to countries addressing these national actions. And in the top left corner, you'll see countries that have more than 50% of action underway on those national actions, but less than 50% coverage specifically on the hand hygiene indicator. And this is an example, you could look at this across water, sanitation, hygiene, of where we need to support countries. We have high need, but they're demonstrating readiness to implement. And lastly, this progress report looked at electrification. We'll hear more from electrification colleagues later in this session. And we looked at questions across baseline assessments, costed roadmap, and monitoring indicators. And similar to what we were finding for wash and waste, there is some work being done on baseline assessments, monitoring indicators, and costed roadmaps, but sufficient effort is needed in order to address this to advance electrification in healthcare facilities, particularly around costed roadmaps. Again, not surprising, that is similar to what we see for wash and waste indicators. Lastly, I just want to talk about some of the countries that are moving this ahead, and in particular, the emphasis on these roadmaps. We've mentioned this as a core recommendation to move ahead on this issue is to ensure that we have costed roadmaps in place. And both Ethiopia and Indonesia have addressed this over the past few years. In Ethiopia, they put together a roadmap for 2025 to 2035, looking at the cost of over the next 10 years at $652 million. And they describe the kind of financing that will need to be leveraged across federal and regional governments, as long as support needed from development partners and local governments and communities. Indonesia had a similar approach. They looked from 2021 to 2030, and they not only addressed a focus on primary healthcare, but also looking at gender equity through inclusive policies, facility design, and monitoring. They estimated a need of $500 million for the targets set out in the roadmap, and 75% of the funding would be leveraged from the national, district, and provincial governments. So all of these resources are available on washandhcf.org. Highly recommend you taking a look at these that have been captured through this process, particularly if these are countries you're working closely with, or to get examples for your own country of how you can have a template or an example for a roadmap. Lastly, we put together recommendations from this report, and they are aligned with previous recommendations we've had on wash and healthcare facilities. And the first is that we need to integrate safe and sustainable wash, waste, and electricity into health systems programming, financing, and implementation. And that requires finance domestic priorities, engaging in joint advocacy, and developing and implementing costed roadmaps. Secondly, we need to regularly monitor and review and strengthen accountability. And we saw earlier that monitoring is one of the areas where there's significant effort required to ensure that indicators are included into national systems. And so that's one of the core recommendations out of this in order to, as Maggie mentioned at the start, address some of those major gaps we have in data and be able to guide future investments. And then lastly, we need to develop and empower the health workforce. We did address this in this report. There is some effort underway by countries to support WASH and IPC through pre-service and in-service training, but often these are not national level programs. So by developing these further, by providing clear job descriptions, compensations, and safe work environments, we can ensure that there is not only the services in place, but the ability to deliver that safe quality of care through wash, waste, and electricity. So I'm going to stop there and hand back to Rola so we can hear actually from various countries on their perspectives here.
Thank you, Maggie and Lindsay, for this excellent presentation on the global findings. I don't see any questions posted, so if you don't mind, can I post some questions, ask you some questions on the report?
Absolutely.
Great. So how are you using this data globally? I mean, what data and messages resonate the most with convincing leaders to take action and to act, in your opinion?
Yeah, great question, Rola. I'll jump in here, but Lindsay, feel free to expand. But I think there's a few things. I mean, one, just raising awareness, right? That there are gaps, because I think there's still a lot of our health colleagues in various health programs are unaware that some of these basic services are missing. But I think second, there's a lot of interest to obviously partner with and invest in countries who are putting in place these building blocks to make sure they have, sustainable universal services. So for example, the work that's happening now around AMR and national action plans, they're very keen to understand which countries have wash and waste standards, which countries are putting in programs like Wash Fit and incremental improvements, so they can better partner what they're doing on the AMR side with some efforts that are already ongoing on the water and sanitation side. Likewise, we see similar interest, for example, from our primary healthcare and our trauma and maternal health colleagues who are really working at that field level to make sure that those basic services, to make sure that the needs and the health of mothers and children is being met.
Thank you. Thank you very much, Maggie. I mean, integration was a key theme in this report, and you have highlighted how working together with other programs can really leverage and accelerate the work on wash and healthcare facilities as well. Okay, great. Thank you very much. So we will now move to the country perspectives to hear from colleagues leading national efforts to improve wash, waste, and electricity services in healthcare facilities. It's my pleasure to start with Dr. Ayman Bani Musa from the Ministry of Health in the Hashemite Kingdom of Jordan. Dr. Ayman is the Director of the Epidemics Administration and head of the National Steering Committee on Wash and Healthcare Facilities. He will share Jordan's experience, highlighting the actions undertaken and key lessons learned in strengthening wash and healthcare facilities. Over to you, Dr. Ayman.
Good afternoon, everyone. I am Dr. Ayman Bani Musa, Director of Epidemics Administration at the Ministry of Health in Jordan. I am very pleased to join this global webinar to share Jordan's experience in advancing WASH and IBC in healthcare facilities. The timeline presents the key milestones from 2022 to 2025 in Jordan's WASH IBC program, from concept development and ministerial endorsement to national assessment and regulatory framework, a process led by MOH in close coordination with national stakeholders, UNICEF and WHO, to advance safe, sustainable wash services across the health system. Next, thank you. In 2022, October started with the submission of WASH in Healthcare Facilities Program concept note to Minister of Health. A month later, in November 2022, came the endorsement of WASH in Healthcare Facilities Program by the Minister of Health. December followed in with both the formulation of the steering and technical committees for the WASH and healthcare facilities national program and the development of the national situation analysis and WASH IBC assessment. In 2023, June saw Jordan hosting the Global Summit on WASH and Waste Health in Healthcare Facilities. The Global Summit brought together over 130 participants from more than 30 countries, including senior representatives from WHO and UNICEF headquarters, regional and country offices, alongside governments, NGOs, and academic institutions. It was followed later in August by the development of high-level WASH roadmap. This was supported by WHO. The high-level WASH roadmap was structured around four themes: political will and leadership, climate resilient and sustainable infrastructure, aligned with the Ministry of Health, Climate Change and Health Strategy 2024. Health workforce development and M&E systems. At the end of 2023, in November, we conducted the nationwide WASH baseline assessment. This was done with support from UNICEF. The national WASH IBC assessment covered 509 public healthcare facilities across all 12 governorates, including 22 hospitals and 487 non-hospital facilities, 365 primary, 365 primary, 115 comprehensive, 7 child and maternity centers. In 2024, September saw the drafting the National WASH and IBC regulation, which was led by steering committee with technical support from UNICEF consultant. Finalization expected in first quarter of 2026. November followed with the development of the M&E framework. This was in cooperation with Directorate of Institutional Development and Quality Control within MOH. By the end of 2024, December, came the integration of WASH IBC checklist into DHIS2 and the WASH in healthcare facilities recognition and accreditation system was developed. In 2025, with support from UNICEF, March saw the piloting the WASH Fit accreditation system into healthcare facilities. The pilot supported infrastructure upgrades, improved WASH, enhanced IBC practices, and staff capacity building, preparing the two facilities for WASH Fit-based accreditation. Lastly, August 2025, the initiation of WASH IBC data collection in 4 governorates, also with UNICEF support. Next slide, please. Lessons learned, government ownership is critical. Strong MOH leadership aligned with national priorities, encouraged in steering and technical committees, ensures national ownership, sustained financing, and long-term institutionalization. Partnership add value, collaboration and coordination with MOH and between stakeholders, UNICEF and WHO, ensured technical depth and program legitimacy. Use of existing system, accreditation as incentives, capacity building meters, scaling requires bulleting. Any question, please?
Thank you very much, Dr. Ayman, for sharing Jordan's experience and insights. Indeed, there's very strong collaboration in Jordan. I have personally witnessed that, working very closely together with UNICEF colleagues in supporting the Ministry of Health and the Ministry of Health Steering Committee and Technical Committee as well. So thank you very much for sharing the experience in the country. We will now turn to Ms. Florence Kabinga from the Ministry of Health in Zambia, who will present Zambia's progress, achievements, and lessons from advancing WASH and related essential services in healthcare facilities. Ms. Kabinga, over to you.
Thank you very much. We can go to the slides. Yes, as introduced, my name is Florence Kabinga, Chief Environmental Health Officer from Ministry of Health. And I'm thankful to be part of this webinar and thanking the Zambian team for giving me the chance to present this multi-sectoral intervention for Zambia. Thank you. Next slide. So looking at Zambia's WASH in healthcare facilities, the current status is that we did a baseline survey with UNICEF, and that was in May this year. And what we see here is the current status. So 72% of the healthcare facilities have basic WASH services in comparison to 39% with basic sanitation, 19% of hygiene services at point of care, 42% of waste management, healthcare waste management, and 16% of environmental cleaning. 85% of the health facilities have some form of energy services, drawing to basic services across all 5 service levels. I would say that we are lagging behind in terms of the indicator because only 1% has basic sanitation, water, hygiene services, and cleaning that would like to see. At the same time, 14% of the healthcare facilities failed to achieve basic WASH due to their limit, either they have limited or no service status in hygiene and or environmental cleaning services. Nationally, we also have 87% of healthcare facilities have limited WASH services across all service levels. The next one. Next slide, please. So what are we doing in terms of driving the change to show that we are moving from where we are to the next level? So in terms of standards and guidelines, following the WHO HA resolution, Zambia decided to start with the development of the contextualizing standards to guide service levels. So we have WASH and waste standards in healthcare facilities. We have minimum standards for WASH IPC in healthcare facilities. We have WASH IPC guidelines and SOPs. We also have WASH and waste standards in healthcare facilities. And latest, we have the laboratory waste management guidelines for 2024. In terms of national coordination, we have reactivated the National WASH in Healthcare Facility Technical Working Group to engage partners, coordinate efforts, and track progress. And so this is ongoing, and I would like to really thank everyone that is part and parcel of this group. Infrastructure improvement, government commitment to improve the WASH infrastructure to meet national standards. We have the presidential directives in place, which include design available for the different levels of healthcare facilities, institutionalizing of WASH fit to determine required improvements. With right now we have 527 members of health facilities that have been trained. We have district level mentorship, and in terms of basic assessments, government-led assessment data to inform priority settings and resource mobilization. We indeed working with all partners to ensure that this is happening. And latest to this is the integration of WASH and healthcare facilities indicators in the DHIS tool for monitoring HMIS on the quarterly basis. So we are yet to do a pilot, but this has already been set, and we are ready to take off on this aspect. The situation analysis roadmap, currently working on the situation analysis and costed roadmap to inform advocacy and investment issues, as well as resource needs. This will be able to be done before December this year, so that we already know the gaps in terms of our investment case for water, sanitation, and hygiene. We can go to the next one, please. So what are the next steps for accelerating Zambia's WASH agenda? In terms of data, we need to finalize and publish baseline reports and also pilot the indicators in the DHIS2 and to create a dashboard in the HMIS and also adapt WASH fit across all facilities. We're currently training. We have 6 provinces that will be trained by the end of this year, and we're remaining with 4 provinces that do not have the support right now. And then the costed roadmap, finalize and launch the roadmap, integrate emergency preparedness and response, including climate change and health aspects to ensure that even resilience is integrated in our roadmap, and also evidence-based advocacy for WASH in healthcare facilities financing. We also want to ensure that we improve coordination and coordinated actions among implementing and funding partners, targeting the 87% of health facilities with limited services, especially non-infrastructure investments. And so we hope that when we have the costed roadmap, we'll be able to know the most needy facilities and target those with the investment or with the resources that are available. Go to the next, please. Yes, so for Zambia, I would say in summary, that's what we've done so far. Thank you so much. Any questions?
Thank you very much, Ms. Kabinga, for sharing Zambia's valuable experience and insights. And please, colleagues, don't hesitate to post any questions in the Q&A or the chat if you have any questions to our speakers from the 2 countries that were shared. We've now heard from both Jordan and Zambia, 2 countries demonstrating strong leadership and commitment in advancing wash, waste, and electricity services in healthcare facilities. Their experiences provide important lessons on how political will, national coordination, standards, and investment can drive real progress. It's now my pleasure to hand over to Dr. Bruce Gordon, Head of Water, Sanitation, Hygiene, and Health at the World Health Organization in Geneva, and the Vice Chair of UN Water, who will moderate the remainder of today's session. I was happy to be with you. Bruce, over to you.
Oh, I was thinking the same thing, Rola, so thanks so much. Well, I mean, the next part of the meeting is about partnership, and I was really struck by Florence Kabinga's slide with all the partners on the bottom. So we're excited to hear from World Vision, IFRC, and the Selco Foundation. So I think without further ado, I would like to invite Jesse Mahongo Samuyachi, who's the WASH and Energy Technical Program Manager from World Vision Zambia, to turn on his camera. So Jesse, nice to see you. And I have a question for you. So World Vision has supported hundreds of healthcare facilities in Zambia in order to improve WASH by working closely with communities. So what lessons have you learned from this, and what needs to be done to engage communities further? So over to you.
Thank you so much. I have turned on my camera, but since I don't know if you're able to see me, I think I'm having a bit of technical challenges. My camera is on right now, but I'm not sure if you're able to see me.
We can't see you, but we hear you loud and clear. So
Okay, can I
yeah,
proceed?
very nice to, yeah.
All right. Can I proceed even if I'm having
Yes,
challenges
please.
with my
Please,
camera?
please.
Okay. So thank you so much. Like you've been like you've introduced me. I'm Jessie from World Vision Zambia, and I lead the wash and energy sector. And as World Vision, we have been implementing WASH in healthcare facilities for some time now, and we are usually in the rural areas where they are very hard to reach areas. And in terms of water provision, yeah, we have done boreholes, we've done piped water systems, and most of them are solar powered. And what we have learned over the years is with the provision of WASH, waste management, we have seen a reduction in home deliveries. We have seen communities going to healthcare facilities to look for services because they know that when they have to go to a health facility, they are going to find running water. So that is like a motivation to them. So you find that in these rural areas, you find a lot of mothers giving birth in communities. But with the provision of water, not maybe just what we've done as World Vision, but what lessons we have seen a lot of mothers seeking services from the healthcare facilities because they say, with water, I'm able to give birth in a healthcare facility. I don't need to carry my own water from home if this healthcare facility has no water. But with the provision of water, you see a lot of people going to the facility, and that reduces maternal deaths as well as child mortality rates. So we have seen that even the health staff gets motivated to stay and serve the communities because without water, without proper sanitation and hygiene, even the health staff tend to leave. And that also disadvantages the communities because they will not have access to these better health services just with water in these communities. So we have seen that even the healthcare facilities tend to stay in one place for a long time. Zambia is one of the less developed countries, the developing countries. So you notice that a lot of staff tend to move, like ask for transfers to say, can I go to a better health facility that has water? Because I also need, even as much as I need to save the communities, I need water in my home. I need water even as I'm saving in the community, as I'm attending as I'm attending to the patients. I need this water in sanitation. So with the provision of wash and waste management, we're able to see that staff are really staying and they're able to serve the communities. We have also seen that there's been an improvement in terms of behavior change in the communities because we also work with what we call the community health workers. These are the ones that are in the communities. They're able to help even the health staff to go out there in the communities to help them on some of the behavior changes. So with the provision of water, we are able to see that they're able to use the available facilities to even demonstrate to the communities. We recently started providing electricity to healthcare facilities as well, and we have seen that this has really worked. We know that providing wash in healthcare facilities is not really enough. There's really need for electricity. I'll give an example. There's one area where we recently took electricity, and the stories that we are getting is that patients and mothers were shunning away from those healthcare facilities. Why? Because as they go, they request, for example, a woman uh, visits a healthcare facility in the night, they are requested to carry their own phones for lighting. Even when attending to maybe a delivery, you find that they need to use a phone to conduct a delivery. So that used to make the communities shun away from going to facilities. But with the provision of electricity, we have seen that there's an improvement, even in terms of the services that the healthcare facilities are giving to the communities. They're able to go in the night because they have power. They're able to give proper medication. They're able to keep the medication in the facility because they're able to have the refrigerators where they're able to secure the medicine. The communities as as well, they can go to a health facility at any time. But if there is no power, how do they go to a facility? How will they give proper instructions to say, maybe even as I write, are you able to read? Or if I give you this kind of tablets, these are the number of tablets that you're supposed to take if there is no water and there's no electricity. So with waste management as well as electricity, it is really helpful in that the communities tend to go and seek the services at the healthcare facility. The health facilities as well as the staff, they're able to provide quality services to the communities. And I think one of the steps that we need to go further, even as an organization, is to do proper community engagement. We really need their participation, because without the community, it is very hard for even services to be delivered. We talk about sustainability. So even as we form these committees who are able to manage these wash facilities, these electricity facilities that we provide, we need both. We need the health staff, we also need the communities. Why? Because we need them both, even as we need to sustain these facilities. And this has really worked for us. And we have seen that even if there is any problem, we see the health staff and the community sit together to tackle some of these issues. We see traditional leaders coming in because they're part of the community to help the organization to deal with some of the issues when it comes to sustaining the wash facilities that we provide. And most of the water supply systems that we do for World Vision, they are solar powered. And so it is an advantage for us to say, okay, we've just been providing these solar powered systems for water, but we can also use it for electricity. And that's the step we are going further, to say we can also use the available solar power that we use to provide electricity, because in the few facilities where we've provided electricity, we have really seen the positive feedback from the communities as well as the impact. So
Jesse, if you don't mind me just jumping in, I mean, this is really wonderful, and maybe I'll come back to you if we have enough time, because I really like what you're saying about this kind of interface between the healthcare facility and the community, and I think you are stressing there it could be more even done in that context. So I think people want to hear about that. But if you don't mind, I'll leave you just for a moment, and I'd like to now invite IFRC Mali. I don't know if we have Akili Lakusu Dalande on the panelist.
Yeah.
Okay, perfect.
But it's not from Mali, but from Togo, huh?
Oh, from Togo. Okay, I'm so sorry.
Yeah.
So my question is, can you tell us more about what has been your experience in this integration, IFRC's experience in this integration, and what more needs to be done to scale up efforts? So over to you.
Okay, let me continue in French. So,
Yes.
voilà, je dirais que nous avons une petite expérience en matière de l'eau et assainissement en milieu hospitalier ou en milieu dans les formations sanitaires. Je vais donner simplement l'exemple avec le programme que nous avons actuellement avec le gouvernement togolais qui, sur un prêt de 14 millions de dollars avec la Banque islamique de développement, a octroyé à travers la fédération 4 millions pour soutenir les efforts de l'assainissement dans 4 districts. Et l'objectif, c'était vraiment de pouvoir améliorer les infrastructures d'assainissement dans les établissements de santé dans ces 4 districts-là au profit de 49 000 personnes. Et les activités qui ont été planifiées, qui ont été réalisées, c'est beaucoup l'évaluation de base et les études dans 47 établissements de santé, mais aussi autour, pas seulement dans les établissements de santé, mais une étude de vulnérabilité, de capacité a été faite, n'est-ce pas, dans les communautés et pour pouvoir, n'est-ce pas, adapter les ouvrages dans ces formations sanitaires-là. Donc, nous avons aussi à réaliser au moins 56 blocs de latrines dans ces formations sanitaires-là et de pouvoir, comme je l'ai dit tout à l'heure, de pouvoir adapter ces ouvrages-là suivant les conditions, les contextes réels. Donc, à ce jour, nous avons, si vous pouvez passer au slide suivant. À ce jour, nous avons eu à réaliser 42 blocs de latrines inclusives. Et quand je dis inclusive, c'est-à-dire accessible non seulement aux genres, mais aussi aux handicapés, tout ça. Donc, nous avons eu à réaliser déjà 42 sur les 56 prévus et donc 14 sont en cours de réalisation. Et il faut dire qu'en amont, quand même, en amont de ce projet, nous avons eu à réaliser avec l'appui de la Croix-Rouge suisse déjà aussi des postes d'eau autonomes. 4 postes d'eau autonomes et aussi des incinérateurs pour gérer, n'est-ce pas, les déchets biomédicaux dans ces unités ou dans ces formations sanitaires-là. Donc, dans le cadre de ce projet aussi, nous avons eu à former des volontaires, près de 300, plus de 300 volontaires sur l'approche ATPC FAST, sur le CEA et aussi la surveillance à base communautaire. Tout cela permet, n'est-ce pas, à ces volontaires-là de travailler de concert avec les agents dans ces formations sanitaires pour, n'est-ce pas, assurer la maintenance de ces ouvrages-là et de faire aussi la promotion des jeunes à l'intérieur de ces formations et aussi à l'extérieur de ces formations sanitaires. À ce jour, près de 36 000 personnes ont déjà été touchées par ces activités de sensibilisation. Donc, actuellement, nous arrivons, notre objectif, c'est d'assurer la qualité des ouvrages que nous installons et aussi la qualité de nos prestations. Et pour cela, nous nous basons vraiment sur non seulement les acteurs du projet appuyés par de la Croix-Rouge togolaise, bien sûr, hein, appuyé par la fédération, mais nous travaillons également avec les ingénieurs du ministère de la Santé et aussi du ministère de l'Eau avec qui nous travaillons. Voilà, donc il y a beaucoup de suivi, supervision que nous faisons et nous avons également mis en place un outil qui nous permet de faire des outils, un outil digital hein, qui nous permet de suivre en temps réel le progrès des activités que nous mettons sur le terrain. Donc, dans un futur proche, nous pensons non seulement achever les ouvrages qui ont commencé, surtout les 14 là qui sont en train, qui vont être bientôt achevés, mais aussi surtout travailler sur la durabilité et donc mettre un accent sur le travail de proximité qui se fera entre le personnel de ces formations sanitaires-là et les volontaires, les usagers, pour que les ouvrages réalisés puissent être maintenus. Nous allons aussi, nous pensons aussi faire beaucoup de plaidoyer pour que d'autres établissements, d'autres formations sanitaires qui ne disposent pas d'outils ou d'ouvrages d'assainissement adéquats puissent aussi en avoir. Donc, un accent particulier va être mis, n'est-ce pas, sur la documentation des bonnes pratiques et le partage de ce que nous aurons à faire comme leçon apprise. En tout cas, nous dirons en conclusion que 75% des objectifs ont été atteints, mais que beaucoup d'activités seront menées pour assurer non seulement la durabilité de nos ouvrages, mais aussi assurer notre engagement, l'engagement de la fédération qui est, n'est-ce pas, d'établir que les établissements de santé soient plus sûrs et plus sains. Je vous remercie.
Thanks so much for sharing that experience of Togo and IFRC. Again, lots to discuss, and I think people would really enjoy hearing more about the issue of how you've looking and thinking about sustainability with these workshops. But I think we need to move on because of time. So now I would like to invite Harish Hende from the Selco Foundation. Nice to have you with us. If you can turn on your video.
Yes, I'm there. I'm on video.
Okay.
Yes. Hi, Bruce.
Oh,
Yeah.
wonderful. Okay. Now you're filling the whole screen, which is wonderful. So, yes, I just wanted to, I mean, you've been successful in electrifying thousands of healthcare facilities in India. So again, the question is, can you tell us how did you manage to do this, and what lessons did you pull out of these experiences? So over to you.
Thanks, Bruce. I think I've gone after we started the program 2 years ago. I've lost all my hair. The issue, what has happened, Bruce, the way we are looking at it right now is in a very different manner. The question is, it's not about solar powering. Yes, our aim is to do 25,000 systems by 2026. We have done till date 12,000. So we are doing 50 a day of health centers. But goal is not about 150 million people getting access to 25,000 facilities which are powered by solar, but our challenge is how do we make sure that 150 million people get sustainable health services, lowering their transaction cost, because poverty is two. Either you increase people's income and decrease people's transaction cost. And health is one of the biggest transaction costs that we need to decrease, right? And so we're saying that let's look at 2035. What happens in the health sector is we always do catch up in the developing world what has happened somewhere else in 2010. What we are saying is let's look at 2035 and can we do that in 2026 with decentralized energy and with AI? Why can't we look at the way we are looking at solar powering health centers today, Bruce? What will happen in 3 years because of AI and because of decentralized energy and teleservices? These PHCs will become post offices. They'll become typewriters. We are not re-looking at how do we deliver health. We are looking at how do you provide solar. That's not the end goal. End goal is how do we re-look at delivering health services at the last mile. And how do we look at teleservices, for example? Can I look at a 10 foot by 10 foot where I have an ATM machine kind of, where a person comes in, sits down, you have access to 5 doctors. One doctor could be in Washington, DC, one could be in Mumbai, one could be there, and say, I'm going to do my blood test remotely. Now you have Apple Watches that does everything else. Why can't I do blood test? That reduces the time for the tribal person to waste 3 days of the month to go to a nearby health facilities. Why can't I relook at maternal labor rooms? The challenge is women are dying because they're not able to reach. Why can't I convert many of the houses into labor rooms with high quality TV and a foldable baby warmer that runs on solar, and a midwife is completely trained? The high quality TV actually has access to 5 gynecologists right now. So can I do mobile thinking? Can I relook at the design? Can I relook at maternal labor room design? Can I deliver blood pressure, everything right at the doorstep? Why not I democratize the health services? What is needed for a health center to be created, and what can I democratize it? Each one, how can I use internet? How can I use AI? And how can I use solar? You rethink how health has to be delivered today. And today what is happening is we are catching up 2010. Let us look at benchmark 2035 and say, why can't I deliver 2035? Why can't Somalia today have what is happening in the Mass General in Boston, the maternal labor room services in Somalia today? Why can't we do that? I don't understand, because what has happened with IKEA Foundation, with Selco, Government of India, and many states, in $45 to $50 million, we have done 12,000 systems. Multiplied by 2, we will finish by 27 March, 25,000, looking at 110 million people having access to teleservices, baby warmers, suction pumps, autoclaves, redesign of maternal table. Can you imagine a person who's paralyzed, a woman who's paralyzed? There is no table that is designed for a person who is paralyzed. How can we not think of it? Why are we thinking of energy is like a salt? It's an enabler. End goal is delivery of health services in a modern manner, where many of the developing countries does not have the baggage. Let us take advantage of not having the baggage and relook at AI and services And we will be able to deliver to the 2 billion people if we just rethink. Otherwise, what's going to happen? We are still talking of water. We are still talking of electricity. We'll think of women dying. And if I open up a presentation, Bruce, of 1994, it's the same presentation. I'm sorry. We have to move on. We have to move on. And that's what we've been trying to focus is the reimagine health services, turn it on its head, design thinking, human centricity, and that has led to us now till 12,000. And hopefully we're doing 50 a day now, and it can be done.
Yeah.
Thanks, Bruce.
Well, I asked you one question, and
Yes.
you came back with a completely different answer than what I expected. And this idea of advancing everything by 10 years, redesign, rethinking with AI as well. I mean, I know that's people like talking about that, but it makes a lot of sense in this context. And the only thing I'm sort of sorry about now is we can't dive into this because people are on schedules. But listen, I mean, I'm going to pass to my really good colleague, Ann Thomas from UNICEF. But I mean, I think this is something that we need to collectively pursue, because I feel like we're all in this business not to, make these very, very slow incremental improvements.
Absolutely.
We're all here together on this call because we want to see something like you described. So thank you very much. Thank you very much, Harish. That was really great. And Anne, I'm not going to give you the full introduction, but just it's great to see you from UNICEF, my colleague, my co-collaborator on Washington healthcare facilities, among other things. Over to you.
Great. Thanks so much, Bruce. And I totally agree with you. I wish we had more time to discuss this and hear more from the countries. It's really so inspiring to hear back on what's happening at the countries level. And this is really an important moment because it's the first report back that we've had on the UN resolution, and it gives us a lot of insight into how countries are thinking and approaching the issue. And we should be really buoyed by the fact that over 100 countries contributed to the report, and over 80% of those countries are making a lot of progress and taking action, including least developed countries. And it demonstrates that progress is not only possible, but that there is this growing momentum that we're seeing around the world. And the progress also shows that we're making progress on national actions, and particularly actions like conducting baseline assessments, situation analyses that enable further action. Where we're not seeing as much action is around the fact that only 14% of countries have secured sufficient financing to implement national roadmaps. So that's an area where we'll be looking to focus in coming years. The two strongest indicators to support universal coverage of wash, waste, and electricity in healthcare facilities were a national facility improvement program and staff capacity building program, and these remain far behind. So that'll be another area where we're looking forward to accelerating, and there's going to be plenty of opportunities coming up to discuss this further. UNICEF and WHO will continue to convene the Global Strategic Network, and these will provide insights into how to increase financing in the coming year. And I think I'll end there, but just to thank you all once again for joining us and sharing your experience, and really a special thank you to all the really fantastic speakers who pushed us to think a bit differently about some of these issues and to hear a little bit about what's happening on the ground. So please do share the report, subscribe to the newsletter for the latest, and join our community of practice. So thanks again, everyone. Have a great day. And closing from this side, I'm not sure if there's someone I pass back to, but thanks so much, everyone. Take care.
Thank you, everyone.
Thank you. Bye-bye.